All right, and we're back in action. Colleagues, at this time, we're going to read out the agency report for the Maryland Commission on Civil Rights, and we have with us Connor Brown. Please do not give him a hard time. This is his first year.
My name is Connor Brown, Policy Analyst with the Department of Legislative Services, here to present the fiscal 2027 budget analysis for the Maryland Commission on Civil Rights. For context, MCCR investigates civil rights violations and works to increase awareness and understanding of discrimination and solutions for addressing it. To begin, on page 1 of the analysis, the fiscal 2027 budget for MCCR increases by about $517,000 or 7.5%, bringing total funding to $7.4 million. On page 2, Exhibit 1 shows an overview of agency spending in fiscal 27. Approximately 88% of the budget supports personnel, which include 49 regular positions, as well as 3 contractual full-time equivalent positions. Moving on to page 3, Exhibit 2 outlines line item changes in the fiscal 2027 allowance compared to fiscal 2026. The primary driver of MCCR's budget increase is personnel expenses, which increased by around $547,000. Helping to offset that is the abolishment of an administrative specialist position. Continuing on page 4 is the personnel section. In fiscal 2026, 12 positions were added to the budget to help address ongoing case processing challenges that had been attributed in large part to staffing limitations. The 2025 JCR requested a report from MCCR on the impact of those additions, and in their December response, the Commission stated that at the time of writing, 7 of the 12 positions had been filled, and MCCR was working on filling 3 of the remaining positions. 2 positions were being held vacant to meet personnel expense reductions in the fiscal 26 budget. As of December 31st, MCCR had 8 vacant positions, which include the administrative specialist position that's being abolished in the fiscal 27 allowance. MCCR should comment on any planned recruitment efforts for vacant positions. On page 5, the key observations section discusses recent patterns in civil rights inquiries and complaints. Exhibit 3 shows that civil rights inquiries received and complaints received for processing it increased, both of those, compared to fiscal 2024, both of those reaching recent highs. On page 6, Exhibit 4 outlines unassigned cases by case type. In fiscal 2025, the number of unassigned cases increased by about 73% compared to fiscal 2024, and all of those were employment cases. In their JCR response, MCCR attributed this primarily to the volume of employment cases versus other types, and reported that at the time of writing their response in December, unassigned cases had dropped to 498, a 13% decrease from the end of fiscal 25 in June. On page 7, Exhibit 5 shows open and pending cases by case type. Employment cases made up approximately 58% of open and pending cases in fiscal 25. Housing was 39%, and public accommodations was at 3%. Almost all growth in open and pending cases between fiscal 24 and 25 was housing cases. On page 8, Exhibit 6 shows the number of cases open over 1 year, which includes both open and pending cases, as well as unassigned cases that exceed 1 year since being opened. Employment cases made up 84% of cases open over 1 year in fiscal 25, and the number of employment cases in this category was up about 37% compared to fiscal 24. This information feeds into Exhibit 7 on page 9, which outlines average processing times by case type. Benchmarks established by MCCR target an average resolution time of 180 days or fewer for employment and public accommodation cases and 100 days for housing cases. However, as you can see in Exhibit 7, MCCR has not met those benchmarks any year between fiscal 2021 and fiscal 2025. While average processing times for public accommodations cases decreased by around 35% between fiscal 22 and 25, Average processing times, increased consistently during that same period. Average processing times for employment cases had been declining each year from fiscal 22 to 24, but they increased significantly in fiscal 2025 from 350 days to 531 days. MCCR attributes this increase in part to the amount of time between case opening and initial interviews. In their JCR response, MCCR also discussed additional efforts being made to reduce case backlogs, which are at the bottom of page 9. MCCR is rolling out a new customer management system in calendar 2026, and they are relaunching their alternative dispute resolution program, which allows for some cases to be resolved through mediation. Finally, on page 10, the Department of Legislative Services recommends adopting committee narrative, requesting that MCCR submit a report discussing measures implemented to reduce case backlogs. And with that, I conclude my presentation, but I'm happy to answer any questions.
Senator Zucker.
Thank you very much, Mr. Chairman. I've got about 20 questions here. No, congratulations. Great job.
Thank you, sir.
I love it. At this time, seeing no further questions out of the 20, we are going to bring up Director Horton.
Contrary to what it may seem, like we do like each other. She's just feeling a little under the weather, so she decided to distance herself a little bit. So I just wanted to point that out. Good morning, Mr. Chairman, Vice Chairman, members of the Senate Health and Human Services Subcommittee. My name is Cleveland Horton. I do have the pleasure of serving as the Executive Director for the Maryland Commission on Civil Rights. I would like to just take a point of privilege to acknowledge some of our wonderful staff who have accompanied me here today. Starting to my right, our Assistant Director, Ms. Nicolette Young, our fabulous Deputy Director, Ms. Yolanda Saunier.
Good morning.
We also have our Education and Outreach Director, Ms. Candace Crenshaw, who is in the audience, my Special Assistant, Spencer Dove. We have our long-tenured General Counsel, Ms. Glendora Hughes, who I would like to just go on the record and acknowledge her over 40 years of state service. And I do that because I'm not sure how many more times I'm gonna have the opportunity to do that. So I did just want to thank her for her great service. And we also have with us today one of our esteemed commissioners, Ms. Kimberly Prescott. So I do want to thank her for being in attendance as well. First, we want to just thank for this opportunity to respond to the Department of Legislative Services fiscal year 2027 budget analysis. We thank our assigned analyst, Mr. Connor Brown. I think you did a fabulous job on your first go-round. We couldn't have had a better analyst. I know some of our former analysts are in the room, but we do support. Yeah, I just want to say that again, you know, I will be brief in my commentary because as you all, I know you all have our written testimony. But our agency is dealing with challenges like many other agencies are dealing with during this time in reference to more work than we have staff. One of our primary challenges, as indicated in the analysis, is just the consistent increase in our inquiries. The number of cases that we are receiving through our agency has continued to increase over the last few years. When we think about where we are currently, we have already matched last year's fiscal year inquiries halfway through the year. We anticipate that our inquiries this fiscal year will probably almost double what we currently had last fiscal year. So as a result of that, it does create a strain on our agency, a strain on our ability to respond to complaints in a more reasonable time frame. It creates a backlog in the beginning of our process through our intake process, and then also creates a backlog through our investigative process. So as a result of that, our agency has been truly proactive in figuring out how we can be more efficient and effective in terms of how we handle complaints to make sure that the citizens are not being significantly impacted by the lack of resources that we have to respond to the high number of complaints that we're receiving as an agency. Some of those efforts, as Connor indicated in his analysis, include the implementation of our ADR program. So we know that we are right now in the infancy of launching that ADR program. but it has already paid dividends in our ability to respond to complaints in a much faster time frame. Last fiscal year, we did a little over 50 mediations, which resulted in over $500,000 in monetary benefits being received for victims of unlawful discrimination. We anticipate as we continue to roll that out, we will be able to address some of the backlog cases that we do have and also be able to provide more relief for victims of unlawful discrimination through our entire state. As Connor also indicated, we are implementing our own case management system. For years, we have been dependent upon the federal administration and using their database systems. We have, for lack of a better word, been locked out of many of those databases recently, and our ability to report and keep track of our data has significantly reduced. By the implementation of this case management system, we will then be able to control all of our data, how we report out, and being able to respond to requests for information in the more expedited manner. We are taking a look at all of our processes from top to bottom in terms of how we can be more effective. How can we change some of our processes? How can we implement AI to help us respond to complaints of discrimination much faster? We're not looking to replace our employees, but we're looking to implement systems that will assist our staff in responding to complaints of discrimination. So we are working with DoIT in ways that we can employ some of the artificial intelligence tools to help us along the way, to help us become more efficient and effective in how we respond to complaints of discrimination across the board. As you all know, currently, we are dealing with the uncertainty of the federal administration, which is impacting us on every level. Our job as a civil rights agency is to be able to respond to civil rights complaints. Well, we know that the federal administration continues to make that an ever-challenging course of work day in and day out. We are currently in partnership with the Department of Housing and Urban Development, as well as the Equal Employment Opportunity Commission. We don't know how long those partnerships will continue because of the uncertainty with the federal administration. For a very long time, the federal government has seen itself as the floor, where as long as you have protected classes that included the 7 federally protected classes, you were considered to be substantially equivalent. The Department of Housing and Urban Development has issued guidance that now says that the federal government is the ceiling, and any agency that decides to protect more groups outside of the 7 federally protected classes are no longer considered to be substantially equivalent. As a result of that, we are potentially facing being eliminated from the Fair Housing Assistance Program, which would have a detrimental impact to our agency and our ability to, again, continue to respond to complaints of discrimination in a more reasonable time frame. So we are keeping our ears to the ground in reference to that, but it is impacting us significantly. It's also impacting the folks that we serve. We know that we are living in a very divisive culture right now. Many folks within our communities are afraid to report complaints of discrimination for fear that they will be retaliated against, which is also impacting the number of folks who feel comfortable with contacting agencies like the Maryland Commission on Civil Rights. I do want to give just another shout out to our Education Outreach Department, who has been truly proactive and aggressive in getting out into communities to make sure that folks know that their rights are still protected here in our state, and that regardless of what's happening on the federal level, our state protections have not and will not change, and we'll continue to do everything that we can to protect the citizens of our great state. So with that, we do request support of the governor's 2027 allowance, and we are here to answer any questions that you all may have.
One question, Director Horton. When looking at the numbers from this year and last year, I know that you said that we still have complaints awaiting investigation remains at 539. Last year, it was 490. I do know that we were able to do the 12 pins that you had requested last year. And I'm also trying to be mindful that, like, the inquiries was at 1,700, and this year it was at 1,900, which was similar to what FY 2023 versus FY 2024. Yeah. But even with the new pins, and I heard you say ADR, I heard you talk about artificial intelligence, like, and I also understand, like, the investigations, like, they just got different optics, so, like, they're maybe a little bit more challenging. But, like, how do we measure, like, when we give 12 new pins and we have more awaiting cases than the previous year, how do we measure success is what I think about.
Yeah, so our success really for us And we were very appreciative of the 12 additional pins. So even what we indicated last year when we got the pins was that it's going to take us time to get those folks in and trained to be able to have an impact on that backlog. So normally what we try to do is take a look at the number of cases that we have coming in, take a look at our backlog, and take a look at what is the average caseload that we have for our investigators, right? We try to keep that caseload, as Connor indicated in his analysis, somewhere around 40. So we can kind of gauge how many employees we need to do the job based off the cases that we have coming in. We do anticipate that inquiry number will continue to climb. As of right now, I think that our number, if we're projecting out, that number will be well over 2,500 inquiries for this current fiscal year. So that means more cases coming in. We're also trying to address the backlog. So you don't see as quick of a turnaround with the backlog because you have so many more cases coming in on the front end as well. But that's how we kind of measure in terms of how fast we are able to do time and process individually from an investigative standpoint. So how long is it taking you from the time that you're assigned a case to the time that you complete the case? Because we do have those internal benchmarks that's also indicated in the analysis. So right now we report out our agency metrics. We are well above our internal benchmarks of 180 days for all of our cases except for our housing, and then 100 days for our housing cases. But individually as investigators, many of our investigators are operating within that internal benchmark. But because we have a backlog on the front end in terms of the time it takes from the time you contact us to get an intake interview, from the time it's assigned, those days are included in our total time and process, which again exacerbates our time and process. So we take a look at individually, where are we with our investigators and how quickly are they turning these cases around once they are assigned for investigation.
Senator Zucker.
Thank you very much. Good to see you, Mr. Director. Just a quick question. Do you concur with DLS recommendation to adopt narrative on the report on the backlogs?
Yes, we do.
Okay, thank you very much.
Seeing no further questions, Mr. Director, I just want to say, first, just thank you for recognizing Ms. Hughes and the shoulders that we stand on. That's so important. And I know you come from good stock, hold good values, and please tell the family I said hello.
I will. Thank you, Mr. Chairman.
And I want to say to Connor, Mr. Brown, great job. First round, and look forward to many more. Colleagues, at this time, we'll bring up Ms. Rye, and we'll hear from the military department.
Thank you.
Thank you, Mr. Chairman.
Thank you, Mr. Chair, members of the committee. I am Yashodhara Rai, and I'll be presenting the fiscal 27 budget analysis for the military department. Starting with the chart on page 1, the fiscal 27 budget for the department decreases by $10.2 million. This is after accounting for the 2 proposed fiscal 26 deficiency appropriations, which are detailed on page 2. Of the total $2.1 million in general funds in proposed deficiency appropriation, $1.1 million funds 28 soldiers who will provide site security at 3 locations. There's a balance of $1.4 million in federal funds expected, and we request the department to clarify if these federal funds are already budgeted in fiscal 26 working appropriation, and if not, to discuss the timing of budget amendment submission. Another $1 million in proposed deficiency appropriation is to support the critical needs and repairs of facilities across 35 locations. Exhibit 1 on page 3 shows a total of $35.5 million in the department's fiscal 27 allowance. Of this, 55.4% is appropriated for the department's total personnel expenses. The bottom of page 3 highlights the transition of Air National Guard's primary flying mission to a major cyber operation, and we request the department to brief the committees on how this transition may impact the department's budget beyond fiscal 27. On page 4, the second paragraph notes 2 departmental bills introduced this session, Senate Bill 142 and House Bill 232, which expands the definition of eligible institutions for tuition assistance offered to qualifying Maryland National Guard members. This legislation also expands the eligible expenses. About 98% of fiscal 25 appropriation for this program was spent at the end of fiscal 25. And this program is level funded at $600,000 in fiscal 26 and 27. We request the department to discuss the potential fiscal impacts of this legislation. Exhibit 2 on pages 5 and 6 detail the proposed budget changes. As you can see, about $8.3 million of overall budget decrease is due to the closure of the Free State Challenge Academy, FCA, beginning in September 2025, which we will discuss in a minute. This also includes the abolition of 47 positions in fiscal 27 for FCA. Personnel data begin at the bottom of page 6 and continues to page 7. The department abolished a total of 17 positions after the Board of Public Works approved the abolitions of 502.7 positions statewide in October last year. On page 7, the first bullet notes that although the fiscal 27 allowance abolishes 47 regular positions and reduces 4 contractual positions due to the closure of FCA program, 3 regular positions continue to be budgeted for FCA in fiscal 27. We request the department to comment on the reason for the remaining positions budgeted under FCA and any plans to reallocate these positions to other programs. The last 2 bullets on the same page highlight vacancies in the department. 31.5 positions are vacant as of December 31st, 2025, and this does not account for the 47 abolished positions in fiscal 27. Of these 31.5 vacant positions, 12.5 have been vacant for more than a year due to internal hiring freeze. The department submitted a report as required by the 2025 JCR on July 30th, 2025, and noted that of the 49 vacant positions that were reported in last year's analysis, 18 positions were filled, 17 positions were at various stages of being filled or reclassified, 8 positions were vacant due to continued hiring freeze, and 6 positions were abolished. The department also noted that reorganization efforts were being worked on. We request the department to brief the committee on the reorganization efforts along with the targeted positions required for its current operations. Moving on to the first key observation beginning on page 8. This highlights the closure of FCA program. In September 2025, the program was shut down due to plumbing issues at the facility that resulted in the transfer of 14 enrolled cadets to other Challenge Academy locations, and the remaining 38 cadets were transferred to their home schools. Of the 36 FCA staff, all but 2 staff members were laid off. With regards to FCA facility improvements, the fiscal 21 budgeted funds were used to begin infrastructure improvements, and FCA has received funds from the Department of General Services Facility Renewal Fund to continue renovation since then. It is unclear how much funding has been budgeted for the renovation or the status of these renovations, and we request the department to provide a detailed accounting of appropriated funds, expenditures incurred, amounts encumbered, and the status of these renovations. Also, FCA program remains closed with no timeline for opening, and we request the department to comment on the timeline for resuming the operation, spending plan for the remaining fiscal 26 appropriation, and the department's plan for facility improvements during this closure. Exhibit 3 on page 9 presents FCA's performance measures. Due to COVID, there were no classes conducted in fiscal 21. There were 90 students enrolled in fiscal 25, which decreased by 45.8% from fiscal 24. The yellow bar shows that 75% of the graduates continued their schooling, found employment, or entered the military in fiscal 25. This surpasses the program's goal of 70%. The blue bars show GED pass rate, which rose by 10 percentage points to 44% in fiscal 25. The second observation begins at the bottom of page 9 and continues to page 10. This focuses on the TRICARE Premium Reimbursement Program. In a report as required by the 2025 JCR, the department noted that program participation increased from 1,091 members to 1,193 members. Of these, 833 are Army National Guard members and 360 are Air National Guard members. The report also noted that the department's outreach activities include monthly attendance at recruitment programs and maintaining a designated program email to provide program assistance. We request the department to provide the total number of the Maryland National Guard members who are currently eligible to participate in this program and the average premium amount for each coverage plan. DLS also recommends adopting a committee narrative requesting the department to include new performance measures for the TRICARE Premium Reimbursement Program to track program progress with the submission of the fiscal 2028 budget. This recommendation appears on page 11. There are two updates on page 12 and 13. Exhibit 4 on page 12 shows that the Maryland Air National Guard has consistently maintained 100% functionality in their facilities. The Maryland Army National Guard facility functional status lowered by 9% in fiscal 25. This is below the National Guard's goal of 95%. Exhibit 5 on page 13 shows that the department has continued to attend the required 90% of the federally defined authorized troop strength, except in fiscal 21 due to COVID. Pages 14 and 15 are appendices. This is the end of my presentation, and I'm happy to answer any questions.
Thank you, and seeing no questions for Ms. Rye, we'll call up General Burkett.
Good afternoon.
It's always good to see you.
Good to see you all. Good to see you all. Good to see you. And I have my colleagues here today. General Collins, the Assistant Adjutant General, and our CFO, Dr. Linda Weaver. So good to be here with you. Chair McCray and distinguished members of this committee, I'm Major General Janine Burkhead, Adjutant General for the state of Maryland, the Maryland Military Department. Our department thanks Governor Moore, Lieutenant Governor Miller, Mr. Oakman, the DBM analyst, and DLS analyst, Ms. Rye, and the Budget Committee for their continued support. The Maryland Military Department submitted a written response to the DLS budget analyst for your review, and you also have a copy of written testimony. I will use my time today to highlight 5 areas regarding the department. The Maryland Department's mission is to support the Maryland National Guard and maintain responsibility for care, maintenance, and security of our facilities, including 27 readiness centers, 3 military reservations, Warfield Air National Guard Base, and a cyber facility at Fort Meade. Our organization's return on investment, our value proposition, is that one state dollar leverages 3 federal dollars. I'll say it again, one state dollar leverages 3 federal dollars. Regarding operations and maintenance fund, our department receives federal dollars that will be forfeited without a state match every fiscal year. This makes our department unique in a resource-constrained environment. Our O&M funding directly supports our value proposition. One of the most pressing issues facing the Maryland Military Department is the need for operations and maintenance funding, which directly supports our readiness centers, and our readiness centers are our power projection platforms. That's where we're going to deploy from. Historically, our facilities fall short of the National Guard Bureau's readiness goal of 95% on our installation status report, and we're currently averaging about 30% for the conditions and functionalities of our facilities. Funding this program prevents organizational risk to safety, mission, effectiveness, cost overruns, and resilience. Retaining the additional $1 million in O&M is crucial for the critical maintenance requirements of our readiness centers and facilities statewide. Most importantly, it provides a necessary state match to leverage federal funding in Maryland. It would be a shame to leave those funds on the table. The second item is the Free State Challenge Academy. While this program closed in 2025, in September of 2025, we are coordinating with the National Guard Bureau and the Department of General Services to ensure that we can meet the specific goals and requirements of that program. That said, improvements to our facility have been underway with a projected completion date of June of 2026. The third item is the 175th cyber conversion. The 175th wing's transitioning to a cyber wing, and this transition is manpower neutral. We understand that some of our operations and maintenance personnel will retire, transfer to other states, or discontinue their service. But senior leadership is diligently working to ensure every airman can continue their military career if they choose. The change in mission will have no impact to the department's 2027 budget. The fourth concern, current legislation that enhances the STAR program, captured in SB 142 and House Bill 232. This legislation has no fiscal impact. It actually focuses on expanding the financial assistance to service members pursuing trades or apprentices and allows funding to cover licenses and certification costs, personnel protective equipment, and other technical equipment that they ultimately need to improve. Finally, a success story is our department's Healthcare for Heroes program. The phenomenal program, signed into law in 2023, has not only enhanced our medical readiness of our service members, but also their families. The legislation was the first of its kind in the nation, and other states have now followed. Approximately 6,500 service members of the Maryland National Guard are eligible for the program. However, only about 1,200 are currently enrolled, with that reimbursement not to exceed $150 per month. Members may elect not to participate because they have other insurance, they may be deployed. Those are really the reasons why we see them not taking advantage of this program. The critical budgetary investment in public safety by the Moore Miller administration in the 2027 budget will ensure readiness of our soldiers and our airmen and our ability to react when the state and nation calls. I thank you and will be standing by for any questions.
Senator Augustine.
Thank you, Mr. Chair. I am looking at this and I'm trying to, there's a significant decrease in the budget and I'm trying to understand, forgive me, I'm new. I'm trying to understand what is happening here with this significant decrease.
Yes, there's a significant decrease in our budget. And the team is prepared to execute as well as we can with the budget that we're provided.
Okay, thank you.
Senator Jennings.
Thank you. Good to see you. Okay. General, sir. A couple questions. One, first of all, we just had the storm. I want to thank did you have people deployed? Thankfully, I didn't get called for it. But the one thing you had mentioned, the readiness, and I looked at slide 4 on page 12, with the troops that are out with the snow and stuff. And I'm trying to understand this slide with facilities. Are we saying that some of your Army readiness centers are not up to par? Was it 27 you said?
That's correct.
Is that what that's reflecting in this slide?
That's correct. Yes, that's what that's showing, is the readiness of our facilities.
Can you explain what readiness is for is
Sure.
it structural issues?
Structural issues, primarily structural issues. I'll give you, for instance, particularly with the cold, we've had our heating fail in several of our readiness centers. So when the heating fails, we really can't use them, or we try to push to other readiness centers where the heating hasn't failed. We've had, example, the Challenge building where the infrastructure failed us in the sewer pipeline. We could no longer use that building with that being the case. So we had a electric fail in one of our readiness centers where we use this power projection platform for our MI force structure. So things like that. Over several years, we have not been able to keep up with the maintenance nor preventive maintenance of our facilities. So that's why you see that number.
And you call it readiness center. Is it the same thing as I guess we used to call Armory?
Armory. So yes, we call it Readiness Center now because the idea is it's our power projection platform. just like the snowstorm, we use that as a place where we brought in our soldiers and airmen. We housed them. We made sure that they were prepared to go out and run missions. So it is a projection platform. No longer will you see those large bases where we bring in every soldier. It's cost prohibitive for
Like
one thing.
Towson Armory?
Yeah, and just, bring them into one place to get ready to deploy. So that's why Air Guard, we can deploy right from Martin State, right? We have to be ready to deploy.
Got it, okay.
The Army does the same thing. We can deploy from our readiness centers.
Okay. Another question. You had mentioned something, the STAR legislation, but I've also heard something about STAR base.
Yes.
What, are they the same or is it something different?
No, so they're very different.
I guess I know what STAR is, that I remember that legislation. What's STAR
Yes.
base?
STAR Base is a new program that we just recently stood up in Maryland, 100% federally funded, and we bring in fifth graders for 2 weeks, a month, depending on how we organize the program. But the point is that they come in for STEAM and STEM training, hands-on training, and it will coincide with the lectures and what they're going through at their school. So we work very closely with their school to make sure that we are amplifying anything that they're getting in their curriculum at their school.
Got it. Okay. I'm sorry, Chair, I got a couple more. Free State Challenge, so we are going to get it back open? Is that the goal?
The goal is to ensure that we are capable of opening facilities and personnel.
Okay.
I would just want to make sure that is very clear, that we have to have people who are capable of working with young people in the appropriate way, that they are trained, they're cleared,
I
and that
understand
we have a
completely.
facility.
The language we have here, what's being given to us is it's closed.
Well, closed because that's, we are
Well, I was
closed.
hoping to see maybe
basically.
temporarily closed. I think would make me feel a little better.
And we have two people that we have on staff still that are working through issues. As a matter of fact, communicating with the National Guard Bureau today on some of the do-outs that we're working through, SOPs, things like that, to improve our program at the time that it becomes open. So we're continuing to work very closely with the Bureau on those things.
And then one other question. With Martin State, with the Air Guard, we know the planes are gone. And I've gotten questions, I can't get an answer. I don't know if you know it or if I got to go to MAA for it. The runway, the money we had allocated from the feds, did we keep that money to finish that project?
Yes, sir. So we're finishing all the money that was allocated for the runway, and those will continue. We are continuing to look for additional dollars. I believe that's around $35 million to be able to complete that runway through other federal funds. So that's still a work in progress. We were just so close to completing the tail end of the trees that need to be brought down and the wires. So there are grant funds, there are other federal funds as a way to get that done.
So we didn't get the money for that part?
We did not get the money for that part. And actually, as we were, the announcement was coming out that we really were gonna divest, that was the same week that the grant program was making its final decision. So that didn't work out well for us. But,
All right,
yeah.
I thank you. And I guess last thing is I was just hoping to see, I could see a line item for 8 C-130J models, but it's not there, so maybe another year.
It's in invisible ink.
We'll get that on the federal side. Thank you.
Thank
General.
you.
Thank you, Mr. Chair.
Yes, sir. General Burkhead, I first want to start by saying thank you to each and every time that you invited me to the Free State Challenge Academy. And I'm going to say some things that you already know, but I think it's important to say, like, that Free State Challenge Academy impacted a couple hundred young people a year. A program run for 30-plus years. One of the few, probably the only, when we think about just preventative services from that standpoint. I heard you say a date. I heard you say June 2026, but I didn't. So just clarification, just understanding, what does the June 2026 trigger mean?
The facility will be completed somewhere around, that's what we're hoping for or working towards as a deadline, working with General Services and the contractors that are working the issues in the building. So that was the timeline that we hoped that the building would be completed.
Okay.
Our plan.
In FY 2027 budget, there are 3 pins allocated for the facility. I know you talked about 2 of them. Help me understand what the 3 will be doing.
One is a budget analyst, the other is the director of the program, and the other program is the commandant for the program. And it's important, part of the Free State Challenge is that long-term tracking of the cadets that come through. So how do we continue to monitor and track? I use it as an example, the cadets that we sent to programs in New Jersey and DC, they were successful, and part of their success is that they had that reach back to someone here in Maryland to keep that close contact and keep them encouraged, watch over them. So that was an important part. In addition to that, we did have several cadets continue on to complete their the GED through our working with us and making sure that their GED training continued. So those are some of the touch points we continue to use that funding for, and we're using those personnel for. Understanding your point about this being prevention, it was beyond our control about the building and the facility. It was just beyond our control. But some things that are in our control is bringing back a program that better supports those youth with excellence and with people, staff, facilities that are prepared to move forward. I look forward to working with you in that way.
Yeah. I want to lean in and say thank you for the tracking, because that was my next question about those young people that are in DC and New Jersey, and how are we thinking about that? And knowing that when you're a little bit further distance from your home, they have different ways. How far into it do we track, even after they graduate the program?
A year after.
A year after.
Yes, and those cadets did graduate. We only lost one of the two that went to 2 programs by their choosing, but they did very well. Both the director and the commandant went to their graduations in New Jersey and in DC.
Okay. I just want to lean in with the capital budget chair. I know that we've always taken an interest in that specific facility, and if there are opportunities to partner, please don't hesitate to reach out to us. I'm going to take one of the conversations offline. So if I was going to ask about the tracking offline, but that has been answered, I am going to ask more just in reference to the timeline, just better understanding the timeline.
Yes, sir.
In the off conversation. Yes, sir. Senator Jennings.
Go on. I know we have Take Your Boss to Work Day at the base. I think we should do that again, but maybe do Take Your Legislator to Work Day.
Yes.
That you might want to expand that and invite all 188 of us so we can see some of these facilities and understand a little more of the mission, because a lot of people don't understand everything we do with everything. So just a thought.
So noted, absolutely. I just want to give an opportunity for my Assistant Adjutant General. Did you have anything you want to add?
Certainly, and it's to your point about the facilities. As you heard in the report, the Army facilities fall well below the 95% ISR rating, and ISR rating is that installation status rating, specifically focused on 2 metrics. One's condition, and the other one is functionality. When we talk about condition, we're talking about heating, cooling, fire prevention, leaky roofs, things of that nature. When we talk about functionality, we're talking about meeting the needs of the unit at that facility. So since 9/11, we have undergone massive transformation in the Army, and more recent in the past couple of years. Sizes of vehicles, the types of supplies, the types of training that needs to be done. These armories that we have right now, a lot of them age around 50 years. We have one of our facilities, one of our armories, is half the age of the Army. That we just celebrated our 250-year birthday for the Army, and our facilities are very old. Where does that impact? When we have things like boilers that were made way back in the past, when they break down, those aren't even manufactured anymore. So what has to happen is the parts that break have to be built from scratch, which increases the cost overall for our maintenance posture. And so that's one of the biggest challenges we're facing. And that just goes back to what the Adjutant General just mentioned earlier in her testimony, which is our value proposition of 1 state dollar equals 3 federal dollars. And so to be clear about that is the federal funds that we have to turn back in if there is no state match. It's not like, hey, you have federal funds, you can fix this part of the facility. If there's no state match to it, we have to turn it back in. So that's one of the things we thought was very relevant to this current resource-constrained environment.
Are you able to show us how much federal funds we have that we have to match? Do we have that number? Do we know it?
Every year it varies, but we can certainly circle back with you, but it's
I
quite
think
significant.
the subcommittee would know that, saying, hey, I'm just gonna throw a number out there. There's $3 million that we get federally. So,
It's
so we
way
only
more
have to
than
come up
that.
with $1 million? Okay. Whereas if we knew what the target was, I think it might be helpful. I don't know if it's in here or not, or if you could provide it.
It's not in here, but I can certainly get you that number and what we're projected to have for the upcoming year.
Okay, thanks.
Seeing no further questions, General Burkhead, I just want to say, always hold you in the highest regard. Just, how you're rooted in service, leading for not just the folks that are here, but just for future generations to come, and how you always thoughtfully just speak to, like, your mentorships, like the mentors that poured into you and the shoulders that you stand on. Look forward to the conversation offline. Ms. Rod, just thank you for helping us unpack the agency and your due diligence, making sure that we can see it very clear. Colleagues, we'll have our last agency report out, which will be from the Maryland Institute of Emergency Medical Services System, and at that time, we'll have Ms. Camaro giving a readout.
Thank you, Mr. Chair. Good afternoon. My name is Naomi Camaro. I'm a budget analyst with the Department of Legislative Services, and I'll be presenting on the fiscal 27 budget for the Maryland Institute for Emergency Medical Systems. So on page 1 of your report, you can see that the fiscal 27 budget increases by $1.1 million over the fiscal 26 working appropriation to $26.6 million. Page 2 summarizes some of the risks that we flagged from the recent federal rescissions. MIMS did not actually lose any federal funding, but this summarizes some of the grants that we thought were going to be impacted. Page 3 breaks out the fiscal 27 budget by spending. So you can see a majority of the budget is dedicated to personnel, and there's about 17% of the budget that's spent on the telecommunications systems and IT systems that MIMS relies on. Pages 4 and 5 summarize the changes in the budget between fiscal 26 and fiscal 27. So again, the total budget grows by about $1.1 million, and that's driven largely in expenses related to updates to microwave links that are used for MIMS emergency communication systems. So that's about an $880,000 increase. There's also a large increase that is allocated to employee and retiree health insurance, which we've seen across many state agencies. On page 5, there's a summary of the changes in personnel. So MIMS did not add any new regular personnel in fiscal 27. I did want to point out that they abolished one position in fiscal 26 through the voluntary separation program that went into effect last year, resulting in about $80,000 in savings in fiscal 26. Regarding vacancies, as of December 31st, MIMS had a vacancy rate of 9.8%, or 10 vacancies, which was 4.29 above the number needed to reach budgeted turnover. Of these vacancies, MIMS indicates that 2 have since been filled since December 31st. 2 have been sent offer letters for, and then the others they're going to start recruiting shortly. Pages 6 and 7 summarize some of the efforts that MIMS has taken to expand access to AED in public spaces, and we pointed out a couple of pieces of legislation, including chapters 613 and 614 of 2025, which require local public libraries to obtain and register the AED, and chapter 764 of 2024, which requires MIMS to co-locate up to 2 doses of naloxone with each AED. For both of these efforts, MIMS is tracking the AED location through their AED registry. And the rest of the discussion notes a couple other data systems that MIMS maintains and oversees to kind of coordinate some statewide efforts around emergency response. So finally, DLS recommends that the committee concur with the governor's allowance, and that concludes my presentation.
And thank you, Ms. Camaro. At this time, we'll bring up Dr. Delbridge, Mr. Director.
Just so you don't think I'm crazy, I brought backup with me. Good backup. Good afternoon, Mr. Chair and distinguished senators. I'm Dr. Ted Delbridge, Executive Director of MEMS, the Maryland Institute for Emergency Medical Services Systems, and with me is Kelly Hammond, our Chief Administrative Officer, and Christian Mealy, the Director of Government Affairs. If it would please you, I'd review some of the items in my written testimony and be happy to answer any questions. As Naomi mentioned, MEMS' job is to coordinate the statewide emergency medical services system. We do that by providing medical oversight, promulgating statewide clinical protocols that are used by the EMS clinicians in the field, licensing and certifying EMS clinicians, maintaining a statewide communication system, designating trauma and specialty centers, and licensing and regulating commercial ambulance services. We appreciate the work and comprehensive review by Ms. Camuro, and also would like to acknowledge our DBM budget analyst, Christina Jorge Tunion, for her help in preparing our budget. A couple of things that we pay close attention to are our ability to coordinate activities between the EMS system and hospital emergency departments. We monitor the EMS to emergency department transfer of care interval, the time that it takes EMS clinicians to transfer responsibility of care of their patient from themselves to emergency department personnel. We have a goal that happens within 35 minutes, 90% of the time. Nearly half the hospitals accomplish that goal. We supply updates to hospital leadership weekly so that they can do better work. And we share that information with Health Services Cost Review Commission on a monthly basis so that they can encourage hospitals to improve in that particular area. One of the things that we did over the course of the past year to assist is develop the Emergency Department Advisory System. It's a web-based platform that provides 4 bits of information to the EMS system in the community. One is an indication of the current patient census relative to the emergency department's established capacity, so how busy the emergency department is in real time. 2 is alerts that indicate to the EMS system that a hospital emergency department is unable to care for a particular portion of patients, for example, trauma patients at any given time. The number of ambulances currently en route to the emergency department and the number of ambulances that are currently there and how long they've been there. All these things provide an indication to us of just how busy the healthcare system is at any given time. Ms. Camaro mentioned the AED registry. Last year, MEMS completed a rollout of a new public access automatic external defibrillator AED registry. It supports legislation previously passed that requires AEDs to be in certain grocery stores and restaurants. It also helps us keep track of co-location of naloxone with AEDs, which was the topic of another piece of legislation in 2024. There are currently more than 17,000 registered AEDs in Maryland, and 1,380 have naloxone co-located with them. We're shooting for a target of October 2027 to put naloxone along with AEDs in certain public locations. Part of MEM's job is to designate hospital specialty centers, including trauma centers. We do that by designating trauma centers, pediatric trauma centers, a head trauma center, an eye center, adult and pediatric burn centers, 24 cardiac intervention centers, stroke centers, and perinatal centers. In 2026, MEMS will start to recognize pediatric emergency departments, or I should say emergency department based on their pediatric readiness capabilities in 3 categories. And finally, I'd be remiss if I didn't point out that the heart of the Maryland EMS system is really its 20,000 EMS clinicians, emergency medical responders, emergency medical technicians, cardiac rescue technicians, and paramedics. In the past year, they answered more than 1 million calls for help and transported more than 586,000 Marylanders to Maryland hospitals throughout the state. In 2025, MEMS certified 1,895 new emergency medical technicians and licensed 290 new paramedics. That's my update, and I'm happy to try to answer any questions. Thank you for your time.
Senator Augustine.
Again, just because I'm trying to understand, what is the special fund? Where does that come from? I just don't know.
The Maryland Emergency Medical Service Operation Fund is generated from a fee on motor vehicle registration renewals.
Okay.
And to a much lesser extent, surcharge on moving traffic violation fines.
Okay, so it's a part of the registration.
Yes.
It comes into this special fund.
Yes.
Okay, thank you.
About $24.50. When you register your car for a year, about $24.50 goes to the MEMSOF, which supports MEMS, the Maryland Fire Rescue Institute, 80% of the Maryland State Police Aviation Command for its medevac mission, and funds Senator Amos Fund at $16.5 million a year to supply grants to local jurisdictions for acquisition of capital items.
Thank you.
Thank you, and just a little bit of background, Senator Augustine, like the thinking is that when vehicles that are impacted through accidents and things of that nature is why it was directed through the vehicle. Seeing no further questions at the time, Dr. Delbridge, I just want to thank you for just all that you do and making sure that Maryland's prepared for if we do go through specific storms. And we also appreciate your phenomenal backup, the team that you had with us. And Ms. Camaro, just thank you for your due diligence in reference to the agency report, but more importantly, just thank you to all the analysts that were joined with you today. Colleagues, seeing that there are no more agencies at this time, this is the end of our first Health and Human Services Subcommittee. Thank you again.
Thank you.
Thank you.